Hi, I'm Dr. Gvantsa Khizanishvili, and this is Global Health Unpacked, a weekly OncoDaily interview series spotlighting the latest global health trends with leaders shaping the future of global health and cancer. And today I'm joined by Dr. Julie Gralow from American Society of Clinical Oncology. And our focus of the conversation is on AI and how it could be used to increase equity in cancer education, research, and care globally. Julie, welcome and thank you so much for joining us.
Thanks, Gvantsa. It's good to see you.
Good to see you too. So there is a lot of discussion this year, especially at World Economic Forum in Davos, about AI and its role in shaping the future of health. From your perspective, how do you see AI contributing to a greater equity in global cancer education, research, and care?
Well, I think artificial intelligence and digital technology really has the potential to democratize expertise in a lot of ways. It doesn't just make care better for those who already have it, but it can bridge the gap for those who don't. So that whole democratization, I think in global cancer education, it can really help be a force multiplier in regions where specialists are scarce. So it can bridge that specialist gap through guidelines assistance that are AI powered. We at ASCO are working on, with Google Cloud, on guidelines assistance to access our guidelines real time. We're also using AI to generate guidelines. So AI is in the background screening for updates in different topics and presenting it to our human panels. Humans will always be a part of it. And then we can update real time and create living guidelines. So the latest data. And that's the way that oncologists are going to be able to access data. We cannot remember all of this right now. Also, AI has the potential to bridge the language barrier. You know, it can easily translate both at the clinician level, but also at the patient level. And it can really help with the education for the frontline workers who don't all speak English. You know, most of the world doesn't. And it can also empower patients because we've seen some excellent examples of AI chatbots who can talk to patients remotely, wherever they are, and bring the level of information to the level of the patient and what they want to hear. So that's all in education. And then you get into research. And I think AI really has the potential to fix the data bias about populations who are underrepresented in clinical trials. You know, we can use real world data actually and real world evidence to show what's happening outside of those highly selected people who enroll in clinical trials and show how therapies really work and what the toxicities really are out in the real world. We can use AI to match for clinical trials, and we can actually use AI to accelerate drug discovery. I mean, that's really a cool use. And then in care, I really think AI has the potential to help us with what we call precision public health, to maximize impact when there's limited resources. And so diagnostics, it is so cool what's happening with pathology and AI tools using handheld devices and AI-supported cervical cancer screening where you can use smartphone images and send it to experts and ask them for their opinions. We've got efficiency in radiation, in pathology, where we can do radiation planning remotely, so we don't need the experts on the scene. We can treat more patients a day. We can shorten wait lists. And then AI can help with models with individual patients that looking at things like, cost and transportation and other barriers. And it can predict for who might drop out of care and help us intervene much earlier. So all of those, the education, the research, the care, I really think, it's crazy what's gone on in the last few months, in the last year or two with AI, and we've got to harness it for its good.
Absolutely. What this really highlights is that AI is not just the technological shifts. It's a decision of values, priorities also, and who global health systems are designed to serve. And building on that, where do you see some of the most promising examples in AI being used to reduce the gap in cancer care? And where are some of those blind spots that still remain?
Well, I like to give a fun example. It was presented at our annual meeting a year ago, and it was related to kind of inner city New York patients who had been recommended and scheduled for a screening colonoscopy and then missed their appointment. And so a patient chatbot that could speak in English and Spanish called the patient to ask them if they had questions about the reason for the scheduling or the procedure, and it could address them at their level. And what we saw was that patients asked questions that they might not have asked a real human because of, some of the embarrassment about the terms and all of that. And at the end of the chat, which was back and forth, and we looked at the transcripts as part of the presentation, the chatbot said, "Would you like me to transfer you to a navigator who can reschedule your appointment?" And they markedly increased those who came in for their screening colonoscopy using that chatbot. And that, to me, is a perfect example of a use. And of course, it spoke English and Spanish. It could speak any language, right? And it really helped patients with the understanding of the procedure, with the technology of the procedure. If they had transportation issues or something, it brought that up. But then the important thing is, at the end, it connected to a real human being.
Mm-hmm. Yes.
So that's a success. You asked about what are some of the barriers. And I would say, what I'm concerned about, in ASCO, we had a task force that came up with our framework, for the ethical use of AI in cancer care, that pointed out some of the cautions. But, AI, it has a marked potential to reduce the gap, but it also, if we don't pay attention, could increase the gap. So we have issues around the world with just access to the internet or electricity, but also data privacy laws in each country and all. A patient types in to a search engine like Google, they don't realize that what they're typing in, it's out there in the World Wide Web for, access. So we need to be using walled gardens, we call it, where the information, the back and forth, what's going on, the patient information they're providing or our medical records are providing is not out there on the web for everybody to access. It's in a walled garden that's contained only for people who should have access to it. So there's real cautions here too.
Yes, I agree. And especially, with my background working in the low and middle income settings, we face a lot of times constraints in workforce infrastructure, access to training, and we need to explore realistically what are in those contexts how this technology can not widen existing inequalities, but actually close these gaps. So I'm really excited to have this conversation with you and understand a little bit more. And before we wrap up, I want to ask you one more question. What do you think is still missing from this global health discussion on AI and equity in cancer care?
Well, in some ways, we're in our infancy. And we've got lots of people working on this. And there's lots of competition, in a sense, of what some of the platforms will be and how we'll use it. I think, I'm not sure it's missing entirely, but I want to make sure it's included as we move forward, which is the patient voice. We are focused on patient-centered care. We need to have the patient perspective in this, in all that we do. What are their concerns? What are they looking for? What do they need? Instead of us, those who are working on the technology, those who are providing the care, saying this is what we think patients need and want. So it's that person-centered focus that it's not missing entirely, but I think it should be strengthened as we move forward.
This is a very positive message. Thank you so much, Julie, for sharing your insights and for your leadership in advancing equitable cancer care globally. And thank you for watching Global Health Unpacked with Dr. Gvantsa Khizanishvili. And we would like to hear from you. How do you see AI being used in healthcare, in cancer research, education, and care in your own context? Share your thoughts and follow OncoDaily for more conversations like this.
Don't forget to like, comment, share, and subscribe to OncoDaily on YouTube. Hit the bell icon to stay updated.